The second component that I go over with all of my separation anxiety clients in initial assessments is medication and a veterinary assessment. Now, I am not a vet, but it is really important that we rule out medical reasons for the dog's separation anxiety before we get started with a training protocol. Because of how important this piece is, one of the things that I include in my initial assessments is also a behavior report PDF for the veterinary team. It's also really helpful to consider the use of anti-anxiety medications way early on in the process rather than saving them as a last resort and only something that we use if nothing else has worked. The most common regret that I hear is people wishing they would have started their dogs on anti-anxiety medications sooner rather than later. This is not me saying that I require all of my clients to put their dogs on anti-anxiety medications before we start training, but I do try to have a conversation about it as early on in the process as possible for most dogs. It's also really common for dogs who have been struggling with separation anxiety for a long time to have some kind of undiagnosed underlying health issue that is contributing to that. Even if your vet has cleared your dog and said that they're perfectly healthy, it is still possible that there is something else going on that you have yet to discover that is contributing to this. If your dog seems to do really well on some days and not others, and you can't find a clear reason as to why that is, like the time of day or the amount of exercise your dog has had, you might want to consider talking to your vet about this and or getting a second opinion if necessary.